Assalamu alaikum. This presentation is on home remedies, simple and available ways for patients with dry mouth to help in controlling their symptoms. These home remedies can be discussed under these four categories. Palliative measures to help in controlling the symptom of dry mouth. Measures to prevent oral and dental diseases in patients with dry mouth or xerostomia, and ways of treating these oral conditions if they establish, and measures to improve salivary function and increase salivary flow rate. Measures to adjust the diet to help in relieving the sense of dryness of the mouth start with frequent and regular sipping of water. Drinking water not only relieves the dryness of the mouth, but also eases in swallowing and hydrate the tissues in the mouth and clean the oral cavity. If dry food is to be taken, it should be accompanied by frequent sips of water. In general, avoidance of dry or hard or sticky or acidic food would be helpful, particularly food of extreme of temperatures, too cold or too hot, and sugary foods that may increase the risk of dental caries in patients with hyposalivation. It's best to try and cut down or avoid caffeine or alcoholic beverages because they would dehydrate the oral cavity tissues and cause general dehydration and increase the sense of oral dryness. A diet that contains food rich in moisture would also be helpful. Vitamin C tablets as a reducing agent break down the disulfide bonds between the cysteine residues in the proteins, and this leads to a decrease in the viscosity of the saliva. But frequent use of vitamin C is not recommended because citric acid and sweeteners are often added to the vitamin C tablets to reduce the bitter taste. The citric acid and the sweeteners could have erosive effects on the dental enamel. Smoking should also be avoided as much as possible, as it can further irritate the dry oral cavity and also cause further dryness of the mucosa. Next is oral lubricants and protectants, starting with olive oil, which is one of the simplest and cheapest oral lubricants and has an established benefit in the treatment of dry mouth. Also, commercially available oral lubricants can be of help. These are predominantly based on carboxymethyl cellulose gel to give the solution some viscosity. They also incorporate other substances like antimicrobial agents, lactoferrin or lysozymes or lactopyroxidase. These are naturally found in saliva and can be added to the carboxymethyl cellulose to give some antimicrobial effect. Oral lubricants and antimicrobial salivary substitutes can be applied as a bolus or as a slowly released intraoral device in the mouth. The use of a humidifier, particularly at a bedside during sleep, can help in alleviating the symptom of dry mouth and also dry nasal passages. Significant improvement in the symptoms can be achieved by shifting the medications taken by an individual patient to a similar drug with fewer xerostomic side effects. For example, the serotonin reuptake inhibitors cause much less dry mouth than tricyclic antidepressants. Also, changing the timing and the dosing schedule of the medications can help. Avoiding taking the medications at night before bedtime can help because this is the time where the salivary flow is at its lowest level. Patients should be encouraged to lubricate their mouth with water prior to the ingestion of the pills and followed after intake of the pills by a full glass of water. Dividing the drug dosages to smaller portions across the day may also help, and informing patients which medications can and cannot be crushed for ingestion is helpful. And saliva substitutes or artificial saliva. Using oral mouthwashes, gels or rinses or sprays and or artificial saliva can all help to reduce the discomfort and improve the function of the oral cavity momentarily. These oral care products are specifically formulated for the dry mouth. They contain no detergents, they have a mild taste, they contain antimicrobial routine. They also contain a thickening agent to provide some viscosity, plus their protective properties. So they have different composition and different viscosity. Among these agents is of prime importance the carboxymethyl cellulose, a mucopolysaccharide, but other agents can also be used, including glycerate polymer, gel base, or natural mucins, hydroxyethyl cellulose, xanthan gum, glycerol, linseed, polyethylene oxide, plus the addition of some salts, preservatives, and sweeteners. These oral products may help to reduce the dryness, the sense of dryness and the discomfort associated with this, and also helps in improving the oral cavity functions for few hours, usually less than 3 hours or so. In clinical studies, they have mild effect on the subjective complaint of xerostomia, but when the salivary flow is measured, they have no effect on objective increase in salivation. It's best to allow the patient to try several of these oral products, the gels, the rinses, the toothpaste, and find which of them would give the greatest possible relief for that individual patients. Usually patients would express some preference for some of the products that contains the carboxymethyl cellulose. These CMC-based products can improve the symptoms of dryness much better than agents containing mucins. These products, either mouth rinses or mouthwashes or toothpaste, can all have a short-term relief from the sense of dryness in the mouth, up to 4 hours or so, and can also help in keeping the patient's mouth and teeth and gums healthy. They can improve the pH buffering in the oral cavity, and if you incorporate synthetic detergents like sodium lauryl sulfate or osmoprotectants like glycine betaine, it also improves the oral cavity functions, but again only for short periods, few hours, maximum 4 hours at a time. The quality of evidence to support the use of local stimulants or lubricants or protectants of the oral cavity is not very high. We could trace 3 randomized control trials only on these products. One of them was a randomized control trial evaluating the synthetic detergent, sodium lauryl sulfate, versus an osmoprotectant, glycine betaine, in a toothpaste formation. And it seems that the glycine betaine offers some symptomatic improvement, relieving also dryness of the oral cavity and the lips. This is one of the 3 randomized control trials. Another randomized control trials showed that using chewing gums to relieve the symptoms of xerostomia is actually better than using artificial saliva in patients on hemodialysis because of end-stage nephropathy. More patients in this group had positive effects from the chewing gums on their sense of thirst. But neither of the products, neither the chewing gum or the lubricant, had much effect on xerostomia apart from the sense of thirst. A third randomized controlled trial used a comparison between a bite guard with a reservoir for artificial saliva against a bite guard without the artificial saliva, and not surprisingly found that using bite guards with artificial saliva gives a better oral health quality and quality of life for people with xerostomia. A Cochrane review on these oral products concluded that you could not find evidence that one brand is better than the other. One brand of these salivary substitutes is better than the other as a treatment of long-standing oral dryness, and it's therefore best to leave it to the patient to try and experiment the whole spectrum of these products and find which would relieve his symptoms most. The major disadvantages of these salivary substitutes is their temporary activity, plus of course the taste of them and the excessive viscosity and the cost. The duration of action is short due to the water-soluble nature of most of the gels used in the composition of these agents. Some of these products also have a low pH, which can contribute to dental erosion. It's not surprising that about 40% of patients with xerostomia would discontinue the use of saliva substitutes and prefer to sip water as required. Another important category in the home remedies for dry mouth is preventive dental care, because extra measures should be taken to prevent the oral complications from low salivary output, including frequent dental and oral evaluation. Between 4 and 6 months, you would need to have a check with the dentist, and radiographs of the teeth should be performed annually. And to prevent dental caries, meticulous oral hygiene and a low sugar diet and regular use of topical fluorides are recommended. In fact, the daily use of a neutral pH sodium fluoride is the most effective means of preventing rampant hyposalivation-induced caries, dental caries. Topical fluoride oral application is very helpful in preventing dental problems in patients with hyposalivation. Fluorides and remineralizing solutions are available as varnishes, dental varnishes, toothpaste, and gels and rinses. It's the daily use of fluoridated toothpaste that is essential. This is the most important item in the dental care of the xerostomic patients. Plus things like topical fluoride application and the form of a tooth varnish, for example. This can be either done from over-the-counter products or from prescription products with higher doses of sodium fluoride. And if the patient is using any dentures, it's important to prevent fungal colonization by daily immersion of the dentures for 30 minutes in chlorhexidine solution, either 0.12% solution or 1% sodium hypochlorite solution. Also, it's important to have the dentures adjusted to avoid any friction or injury to the oral mucosa, and use dental adhesives because the dryness of the mouth may prevent proper alignment of the dentures, and to consider the use of implant bone prosthesis, which may have lower side effects. But if oral candidiasis develops, which is a common complication for patients with salivary gland hypofunction, it needs to be treated promptly. Chlorhexidine 0.12% solution used twice daily, 10 milliliters, to rinse the oral cavity, swish and spit at least twice daily. Or if angular cheilitis has developed, the use of ointments containing either nystatin or triamcinolone can be applied topically 4 times daily, or the use of clotrimazole torches 10 milligrams, again 4 or 5 times daily for at least 10 days. Systemic therapy with antifungal agents should be reserved for patients who are immunocompromised or cases that are refractory to topical therapy. Another line of management would be to try and increase the salivary output, particularly from the major salivary glands, in patients who are still having residual functioning salivary gland tissue. And various products, including the chewing gums and hard candies, lozenges, and sprays, have all been tried. They must be sugar-free and non-acidic, of course, to avoid any dental erosion. Chewing gums in particular is of some help in producing some salivary output through the reflex action mediated by the periodontal receptors by chewing. And of course, additives can be added to the chewing gums or the other products to help in preventing dental caries, like sugar-free xylitol containing and mints and candies and the gums. Chewing gums will stimulate salivary flow, but not much. and can provide some transient relief of xerostomia. Although it is effective in stimulating saliva, the usefulness of chewing gum in the management of xerostomia is limited. It is, however, more effective in reducing the dryness of the mouth than all the mouth lubricants, particularly in patients who had radiotherapy or hemodialysis. A novel way of trying to increase the salivary flow is electrostimulation of the salivary glands via the lingual nerves. This can reduce the symptoms of dry mouth and increase the salivary flow. The electrostimulation would augment the salivary reflex by directly stimulating the efferent neural pathways of the submandibular and the sublingual salivary glands. They are the glands more important in providing the basal salivary output. Stimulating electrodes can be incorporated in a removable device or a dental implant to directly stimulate the lingual nerves. Literature on the effectiveness is fairly limited, but there is a large randomized controlled trial on the way on patients with xerostomia after head and neck cancers and radiotherapy-induced hyposalivation. And finally, acupuncture. There are some available studies that suggested that acupuncture could provide symptomatic relief from the sense of dryness, including randomized crossover studies. But 3 and independent large systematic reviews concluded that there remains insufficient evidence to support that acupuncture can be used as a standard treatment for dryness of the mouth. Even when it is suggested that acupuncture is of some help in symptomatic relief, there was no evidence or significant changes in the stimulated or the unstimulated salivary production. By this, we come to the end of this presentation on home remedies for patients with dry mouth xerostomia. Assalamu alaikum.